require a blood transfusion. These laboratory findings are often expected in a client who is anemic secondary to ESRD. 2. The dialysis access is compromised, therefore, this client warrants intervention because Mr. Ray cannot perform hemodialysis. 3. It is not uncommon for a client undergoing dialysis to be exhausted and sleep through the treatment, therefore, this does not warrant intervention. 4. The client in end-stage renal disease would not have urinary output, therefore, this does not warrant intervention from Mr. Ray. 3.1. Ms. Mary can restart the client's 4 access without notifying the healthcare provider. 2. Hypoactive bowel sounds may be abnormal, but airway problems take priority over gastrointestinal distress. Remember Maslow's hierarchy of needs. 3. The client may be developing pneumonia or acute respiratory distress syndrome, therefore, Ms. Mary should notify the healthcare provider. This is a complication of surgery. 4. A 2+ pedal pulse is expected data, therefore, Ms. Mary does not need to notify the healthcare provider. 4.1. Normal blood urea nitrogen levels are 7 to 18 mg/dl or 8 to 20 mg/dl for clients older than age 60 years. 2. Normal creatinine levels are 0.6 to 1.2 mg/dl. 3. Glomerular filtration rate, GFR, is approximately 120 ml per minute. If the GFR is decreased to 60 ml per minute, the kidneys are functioning at about 1/2 filtration capacity. 4. Normal creatinine clearance is 85 to 125 ml per minute for males and 75 to 115 ml per minute for females. 5. Answer, 1000 ml. First, determine the amount of irrigation fluid. 4000 to 2000 equals 2000 ml of irrigation fluid. Then, subtract 2000 of irrigation fluid from the drainage of 3000 to determine the urine output. 3000, 2000 equals 1000 ml of urine output. 6. 1 and 5 are correct. 1. The client is stable, but Mr. Ray should assess the drainage. The drainage should be light pink for a client who had a TURP. 2. The client is stable, therefore, Mr. Ray should not increase the irrigation fluid, unless the drainage is dark red. 3. If the client is hypovolemic, the head of the bed should be lowered and the foot should be elevated to protect the brain. This client is stable. 4. The surgeon needs to be notified if the client is unstable or experiencing a complication of surgery. This client is stable, therefore, Mr. Ray should not notify surgeon. 5. Mr. Ray should monitor the client's laboratory values for bleeding or infection. 7.1. Ms. Mary needs to complete the admission assessment, but the priority should always be the client's body, therefore, assessing pain is priority. 2. Assessment is the first part of the nursing process and is always priority. The intensity of the renal colic pain can be so intense it can cause a vasovagal response, with resulting hypotension and syncope. 3. Increased fluid increases urinary output, which will facilitate movement of the renal stone through the ureter and help decrease pain, but it is not the first intervention. 4. The nurse should transcribe the client's HCP order, but not priority over the client's body pain is priority. Ms. Brenda, the charge nurse, can check the HCP orders to determine if there is any priority order. Chapter 6 Renal and Genitourinary Management 171 Scenario Answers 8. 1. The urine must be assessed for bleeding and cloudiness. Initially, the urine is bright red, but the color soon diminishes, and cloudiness may indicate an infection. This assessment should not be delegated to Ms. Debbie. 2. Teaching cannot be delegated to Ms. Debbie, and the client with renal calculi should not have an indwelling urinary catheter. 3. The client's urine must be strained to determine if the renal stone was dissolved and is being passed out of the body. Straining the urine is not assessment, teaching, evaluation, medications, or an unstable client, therefore, this can be delegated to Ms. Debbie. 4. The client is not on strict bed rest after lithotripsy, therefore, Ms. Debbie should not implement this intervention. 9.1. The client with a palpable thrill is stable, therefore, Ms. Brenda would not need to see this client first. 2. The client with acute glomerulonephritis is expected to have hematuria and proteinuria, therefore, Ms. Brenda should not assess this client first. 3. The sign/symptom of bladder cancer is painless hematuria, therefore, Ms. Brenda would not need to see this client first. 4. An ileal conduit is a procedure that diverts urine from the bladder and provides an alternate cutaneous pathway for urine to exit the body. Urinary output should always be at least 30 ml per hour. This client should be assessed to make sure that the stents placed in the ureters have not become dislodged, or to ensure that edema of the ureters is not occurring. 10.1. Teaching cannot be assigned to an LPN, no matter how knowledgeable the LPN. 2. This client has the laboratory symptoms of an infection, therefore, Ms. Mary cannot assign an unstable client to the LPN. 3. Antineoplastic medication can only be administered by a qualified registered nurse. 4. The LPN can administer narcotic analgesics to a client. Therefore, this would be an appropriate assignment. 172. Prioritization, delegation, and management of care for the NCLEX-RN registered exam. 173. Neurological management. 7. To be effective and organized, the nurse must continually prioritize what must be done. Ray A. Hargrove. Huddle 1. The charge nurse has received laboratory data for clients in the medical department. Which client would require intervention by the charge nurse? 1. The client diagnosed with a stroke who has a platelet level of 250,000/L. 2. The client with a seizure disorder who has a Divalpro X, Depakote, level of 75 g/ml. 3. The client with multiple sclerosis on prednisone who has a glucose level of 208 mg/dl. 4. The client receiving the anticonvulsant phenytoin, Dilantin, who has serum levels of 24 mg/dl. 2. The nurse is administering medications for clients on a neurological unit. Which medication should the nurse administer first? 1. A pain medication to a client complaining of a headache rated an 8 on 1 to 10 pain scale. 2. A steroid to the client experiencing an acute exacerbation of multiple sclerosis. 3. An anticholinesterase medication to a client diagnosed with myasthenia gravis. 4. An antacid to a client with pyrosis who has called several times over the intercom. 3. The nurse has just received the shift report. Which client should the nurse assess first? 1. The client with Guillain-Barré syndrome who has ascending paralysis to the knees. 2. The client with a C6 spinal cord injury who has autonomic dysreflexia. 3. The client with Parkinson's disease who is experiencing pill rolling. 4. The client with Huntington's disease who has writhing, twisting movements of the face. 4. The nurse and unlicensed assistive personnel, UAP, are caring for a client with right-sided paralysis. Which action by the UAP requires the nurse to intervene? 1. The UAP places the gait belt around the client's waist prior to ambulating. 2. The UAP places the client on the abdomen with the client's head to the side. 3. The UAP places her hand under the client's right axilla to help the client move up in bed. 4. The UAP praises the client for performing activities of daily living independently. 5. The charge nurse is making client assignments for a neuromedical floor. Which client should be assigned to the most experienced nurse? 1. The elderly client who is experiencing a stroke in evolution. 2. The client diagnosed with a transient ischemic attack 48 hours ago. 3. The client diagnosed with Guillain-Barré syndrome who complains of leg pain. 4. The client with Alzheimer's disease who is wandering in the halls. Question 6. The client diagnosed with a cerebrovascular accident, CVA, has residual right-sided hemiparesis and difficulty swallowing, but is scheduled for discharge. Which referral is most appropriate for the case manager to make at this time? 1. Inpatient Rehabilitation Unit. 2. Home healthcare agency. 3. Long-term care facility. 4. Outpatient therapy center. 7. The nurse and LPN are caring for a client diagnosed with a stroke. Which intervention should the nurse assign to the LPN? 1. Feed the client who is being allowed to eat for the first time. 2. Administer the client's anticoagulant subcutaneously. 3. Check the client's neurological signs and limb movement. 4. Teach the client to turn the head and tuck the chin to swallow. 8. The nurse is caring for a client diagnosed with Alzheimer's disease. Which nursing tasks should not be delegated to the unlicensed assistive personnel, UAP? Select all that apply. 1. Check the client's skin under the restraints. 2. Administer the client's antipsychotic medication. 3. Perform the client's morning hygiene care. 4. Ambulate the client to the bathroom. 5. Obtain the client's routine vital signs. 9. The nurse on the surgical unit is working with an unlicensed assistive personnel, UAP. Which task is most appropriate for the nurse to delegate to the UAP? 1. Change an abdominal dressing on a client who is 2 days postoperative. 2. Check the client's insertion site on the right arm. 3. Monitor vital signs on a client who has just returned from surgery. 4. Escort a client who has been discharged to the client's vehicle. 10. Which client should the charge nurse assess first after receiving the change of shift report? 1. The client with a C6 sigh who is complaining of dyspnea and has a respiratory rate of 12 breaths/minute. 2. The client with an L4 sigh who is frightened about being transferred to the rehabilitation unit. 3. The client with an L2 sigh who is complaining of a headache and feeling very hot all of a sudden. 4. The client with a C4 sigh who is on a ventilator and has a pulse oximeter reading of 98%. 11. The client with a C6 spinal cord injury, sigh, comes to the emergency department complaining of a throbbing headache and has a B/P of 200/120. Which intervention should the nurse implement first? 1. Place the client on a telemetry unit. 2. Complete a neurological assessment. 3. Insert an indwelling urinary catheter. 4. Request a stat CT scan on the head. 12. The intensive care unit nurse and unlicensed assistive personnel, UAP, are caring for a client with right-sided paralysis secondary to a cerebrovascular accident. Which action by the UAP requires the nurse to intervene? 1. The UAP performs passive range of motion, ROM, exercises for the client. 2. The UAP places the client on the abdomen with the head to the side. 3. The UAP uses a lift sheet when moving the client up in bed. 4. The UAP praises the client for attempting to feed him or herself. 174. Prioritization, delegation, and management of care for the NCLEX-RN registered exam 13. The critical care charge nurse is making client assignments for the shift. Which client should the charge nurse assign to the graduate nurse who just completed the orientation? 1. The client with amyotrophic lateral sclerosis on a ventilator who is dying and whose family is at the bedside. 2. The client who has a closed head injury and has increasing intracranial pressure receiving intravenous osmitrol, mannitol. 3. The client with a C5 spinal cord injury who is experiencing spinal shock and is on the vasoconstrictor dopamine. 4. The client with a seizure disorder who has been experiencing status epilepticus for the past 24 hours. 14. The critical care nurse is caring for a client with a head injury secondary to a motorcycle accident who, on morning rounds, is responsive to painful stimuli and assumes decorticate posturing. 2 hours later, which data would warrant immediate intervention by the nurse? 1. The client has purposeful movement when the nurse rubs the sternum. 2. The client extends the upper and lower extremities in response to painful stimuli. 3. The client is aimlessly thrashing in the bed when a noxious stimulus is applied. 4. The client is able to squeeze the nurse's hand on a verbal request. 15. The charge nurse is making rounds and notices that the sharps container in the client's room is above the fill line. Which action should the charge nurse implement? 1. Complete an adverse occurrence report. 2. Discuss the situation with the primary nurse. 3. Instruct the UAP to change the sharps container. 4. Notify the infection control nurse immediately. 16. The wife of a client diagnosed with a brain tumor tells the nurse, "I don't know how I will make it if something happens to my husband. I love him so much." Which statement is most appropriate for the nurse? 1. I will call the chaplain to come and talk to you. 2. Do you have any family support to be with you? 3. You don't know how you will make it if something happens. 4. Do not worry, everything will be alright. You are a strong woman. 17. Which priority client problem should be included in the care plan for the client diagnosed with Guillain-Barré syndrome who is admitted to the critical care unit? 1. Decreased cardiac output. 2. Fear and anxiety. 3. Complications of immobility. 4. Ineffective breathing pattern. 18. To which collaborative healthcare team member should the critical care nurse refer the client in the late stages of myasthenia gravis, MG? 1. Occupational therapist. 2. Physical therapist. 3. Social worker. 4. Speech therapist. 19. The nurse caring for a client is accidentally stuck with the stylet used to start and for infusion. The nurse flushes the skin with water and tries to get the area to bleed. Which action should the nurse implement next? 1. Have the laboratory draw the client's blood. 2. Notify the charge nurse and complete the incident report. 3. Contact the employee health nurse to start prophylactic medication. 4. Follow up with the employee health nurse to have lab work drawn. Chapter 7 Neurological Management 175 Questions 20. The nurse is caring for clients in a long-term care facility. Which client should the nurse assess first after receiving the morning report? 1. The client diagnosed with Parkinson's disease who began to hallucinate during the night. 2. The client diagnosed with congestive heart failure who has 3+ pitting edema of both feet. 3. The client diagnosed with Alzheimer's disease who was found wandering in the hall at 0200. 4. The client diagnosed with terminal cancer who has lost 8 pounds since the last weight taken 4 weeks ago. 21. The nurse in a long-term care facility is administering medications to a group of clients. Which medication should the nurse administer first? 1. Acetyl-salicylic acid, aspirin, to a client diagnosed with cerebrovascular disease. 2. Neostigmine, prostigmine, to a client diagnosed with myasthenia gravis. 3. Cephalexin, Keflex, to a client diagnosed with an acute urinary tract infection. 4. Acyclovir, Zovirux, to a client diagnosed with Bell's palsy. 22. The nurse in a long-term care facility is developing the plan of care for a client diagnosed with end-stage Alzheimer's disease. Which client problem is priority for this client? 1. Inability to do activities of daily living. 2. Increased risk for injury. 3. Potential for constipation. 4. Ineffective family coping. 23. The clinic nurse is providing discharge instructions to an elderly client diagnosed with cataracts. Which intervention is most important for the nurse to implement? 1. Teach the client to increase the light in the home. 2. Encourage the client to wear dark glasses outside. 3. Discuss the need to have the cataracts removed. 4. Tell the family not to rearrange furniture in the home. 24. A wife tells the clinic nurse her husband had been fine and is now confused, doesn't know where he is, and is not acting like his usual self. Which intervention should the nurse implement first? 1. Perform a neurological assessment. 2. Notify the client's healthcare provider. 3. Ask the wife to explain more about the behavior. 4. Determine when the client last had something to eat. 25. The charge nurse observes the client's nurse telling the unlicensed assistive personnel, UAP, to feed an elderly client diagnosed with a cerebrovascular accident, CVA. Which question should the charge nurse ask the client's nurse? 1. How does the client swallow the medications? 2. Did you complete your head-to-toe assessment? 3. Does the client have some thicket in the room? 4. Why would you delegate feeding to a UAP? 26. The client diagnosed with a cerebrovascular accident, CVA, is confined to a wheelchair for most of the waking hours. Which intervention is priority for the nurse to implement? 1. Encourage the client to move the buttocks every 2 hours. 2. Order a high-protein diet to prevent skin breakdown. 3. Get a pressure-relieving cushion to place in the wheelchair. 4. Refer the client to physical therapy for transfer teaching. 27. The nurse enters the room, and the client is beginning to have a tonic-clonic seizure. Which action should the nurse implement first? 1. Identify the first area that began seizing. 2. Note the time the client's seizure began. 3. Pad the siding of the client's bed rails. 4. Provide the client with privacy during the seizure. 176. Prioritization, delegation, and management of care for the NCLEX-RN registered Exam-8. The rehabilitation nurse tells the unlicensed assistive personnel, UAP, to assist the client recovering from Guillain-Barré syndrome with AM care. Which action by the UAP warrants immediate intervention? 1. The UAP closes the door and cubicle curtain. 2. The UAP massages the client's back with lotion. 3. The UAP checks the temperature of the bathing water. 4. The UAP puts the side rails up when bathing the client. 29. The client diagnosed with a right-sided cerebral vascular accident, CVA, or brain attack, is admitted to the rehabilitation unit. Which interventions should be included in the nursing care plan? Select all that apply. 1. Position the client to prevent shoulder adduction. 2. Refer the client to occupational therapy daily. 3. Encourage the client to move the affected side. 4. Perform quadriceps exercises 5 times a day. 5. Instruct the client to hold the fingers in a fist. 30. The nurse is the first person on the scene of a motor vehicle accident. The driver is in the driver's seat unconscious. Which action should the nurse implement first? 1. Stabilize the driver's cervical spine. 2. Do not move the client from the accident. 3. Ensure the driver has a patent airway. 4. Control any external bleeding. 31. The clinic nurse is making assignments for the large family practice clinic. Which task should be assigned to the staff nurse who is 4 months pregnant? 1. Have the staff nurse answer the telephone calls from clients. 2. Instruct the staff nurse to work in the radiology department. 3. Tell the staff nurse to work in the front desk triage area. 4. Assign the staff nurse to work in the oncology clinic. 32. Which task is most appropriate for the clinic nurse to delegate to the unlicensed assistive personnel, UAP? 1. Request the UAP to ride in the ambulance with the client. 2. Ask the UAP to escort the client in a wheelchair to the car. 3. Instruct the UAP to show the client how to use crutches. 4. Tell the UAP to call the pharmacy to refill a prescription. 33. The employee health nurse is caring for an employee who fell off a ladder and is complaining of low back pain radiating down both legs. Which intervention should the nurse implement first? 1. Refer the client to an HCP for further evaluation. 2. Complete the workers' compensation documentation. 3. Investigate the cause of the fall off the ladder. 4. Notify the employee's supervisor of the incident. 34. The employee health nurse is caring for a male employee who reports tripping and is complaining of right knee pain. There is no visible injury, and the client has a normal neurovascular assessment. Which intervention should the nurse implement? 1. Request the employee to return to work. 2. Obtain a urine specimen for a drug screen. 3. Send the client to the emergency department. 4. Place a sequential compression device on the leg. 35. The community health nurse is triaging victims at the site of a disaster. Which client should the nurse categorize as black, priority 4? 1. The client who is alert and has a sucking chest wound. 2. The client who cannot stop crying and can't answer questions. 3. The client whose abdomen is hard and tender to the touch. 4. The client who has full thickness burns over 60% of the body. Chapter 7 Neurological Management 177 Questions 36. The Home Health, HH, nurse enters the home of an 80-year-old female client who had a cerebrovascular accident, CVA, or brain attack, 2 months ago. The client is complaining of a severe headache. Which intervention should the nurse implement first? 1. Determine what medication the client has taken. 2. Assess the client's pain on a pain scale of 1 to 10. 3. Ask whether the client has any acetaminophen, Tylenol. 4. Tell the client to sit down, and take her blood pressure. 37. A client has been diagnosed with rule-out bacterial meningitis, and a nurse is assisting the healthcare provider with a lumbar puncture. Which intervention should the nurse implement first? 1. Have the client lie in the lateral recumbent position. 2. Tell the client to empty the bladder. 3. Encourage the client to complete an advance directive. 4. Keep the client NPO prior to the procedure. 38. The Home Health, HH, nurse is scheduling visits for the day. Which client should the nurse visit first? 1. The client with an L4-SI who is complaining of a severe, pounding headache. 2. The client with amyotrophic lateral sclerosis, ALS, who is depressed and wants to die. 3. The client with Parkinson's disease who is walking with a short, shuffling gait. 4. The client with AC5-SI who reports redness and drainage at the halo vest sites. 39. The clinic nurse is triaging clients' telephone calls. Which client should the nurse call first? 1. The client diagnosed with AIDS who has developed Kaposi sarcoma. 2. The client diagnosed with dementia who is having difficulty dressing himself. 3. The client with trigeminal neuralgia who is having lightning-like shock to the cheeks. 4. The client whose friend has botulism who has vomiting and abdominal cramping pain. 40. The Home Health, HH, nurse is caring for a 22-year-old female client who sustained an L5 spinal cord injury 2 months ago. The client says, "I will never be happy again. I can't walk, I can't drive, and I had to quit college." Which intervention should the nurse implement first? 1. Allow the client to ventilate her feelings of powerlessness. 2. Refer the client to the home healthcare agency social worker. 3. Recommend contacting the American Spinal Cord Association. 4. Ask the client whether she has any friends who come and visit. 41. The client being admitted with transient ischemic attack is complaining of a headache. The client is allergic to morphine, iodine, and codeine. Which healthcare provider order should the nurse question? 1. Schedule for CT scan with contrast in AM. 2. Administer acetaminophen 2-po for headache. 3. Take client's vital signs per protocol. 4. Provide the client with a low-fat, low-cholesterol diet. 42. The Home Health, HH, nurse is admitting a female client diagnosed with myasthenia gravis. The client tells the nurse, "Even with my medication I get exhausted when I do anything." Which intervention should the nurse implement? 1. Talk to the client's husband about helping around the house more. 2. Contact the HH occupational therapist to discuss the client's concern. 3. Allow the client to verbalize her feelings of being exhausted. 4. Recommend the client make an appointment with her HCP. 43. The nurse is caring for clients in the emergency department. Which client should the nurse assess first? 1. The client with an epidural hematoma. 2. The client who had a seizure who is in the postictal state. 3. The client diagnosed with R/O encephalitis who has a headache. 4. The client with multiple sclerosis who has scanning speech. 178 Prioritization, Delegation, and Management of Care for the NCLEX-RN Registered Exam 44. The nurse in the neurological clinic is triaging phone calls. Which client should the nurse contact first? 1. The client with a tension headache who is reporting nausea and vomiting. 2. The client with a migraine headache who is reporting bilateral throbbing pain. 3. The client with a cluster headache who is reporting a sharp and stabbing pain. 4. The client with hypertension who is reporting pressure-type pain in the back of head. 45. A client sustained a severe head injury, and his wife is concerned about what to do if he has a seizure when they go home. Which statement indicates the wife understands the most important action to take if her husband has a seizure? 1. I should check to see if my husband urinates on himself. 2. I will move all the furniture out of his way. 3. I will call 911 as soon as the seizure begins. 4. I will make sure he rests after the seizure is over. 46. The multidisciplinary team is meeting to discuss a client with right-sided weakness who has developed a stage 2 pressure ulcer over the sacral area that is not healing. Which priority intervention should the client's home health, nurse recommend? 1. Recommend the client get a hospital bed with a trapeze bar. 2. Recommend a home health aide provide care 7 days a week for the client. 3. Recommend the client be transferred to a skilled nursing unit. 4. Recommend a referral to the home health care agency wound care nurse. 47. The home health aide tells the nurse the client diagnosed with multiple sclerosis is having problems getting out of the bed to the chair, and is now having problems getting into the shower. Which intervention should the nurse implement? 1. Ask the aide whether the bathroom has grab bars. 2. Assess the client's ability to transfer in the home. 3. Instruct the aide to give the client a bed bath. 4. Contact the agency physical therapist about the situation. 48. The nurse is teaching the client with tension-type headaches. Which statement indicates the client needs more teaching? 1. I will do some type of exercise every day. 2. I am going to do yoga techniques when I get a headache. 3. Cold packs to the back of my neck will help my headache. 4. Foods containing amines like cheese and chocolate can cause headaches. 49. The client in a multiple car crash dies in the emergency department. Which priority intervention should the emergency department nurse implement when addressing the needs of the client's family? 1. Ask if the client wanted to be a tissue donor. 2. Give the family the client's personal belongings. 3. Escort the family to a private room to grieve. 4. Determine which funeral home should be contacted. 50. The neurologist has explained to the family of a 22-year-old client with a traumatic brain injury placed on a ventilator after a motor vehicle accident that the client does not have any brain function. Which referral is appropriate at this time? 1. A local funeral director. 2. A hospice agency. 3. A home health nurse. 4. A tissue and organ bank. 51. The nurse is caring for clients in an ophthalmology clinic. Which client warrants intervention by the nurse? 1. The client with cataracts who reports decreased vision and abnormal color perception. 2. The client with a retinal detachment who reports a painless loss of peripheral vision. 3. The client with an external hordeolum who reports red and tender area under eye. 4. The client with primary open-angle glaucoma who reports excruciating eye pain. Chapter 7 Neurological Management 179 Questions 52. The nurse is at a park and observes a client fall and a stick become impaled into the right eye. Which intervention should the nurse implement first? 1. Tell someone to call 911 immediately. 2. Stabilize the stick in the client's eye. 3. Apply direct pressure to the right eye. 4. Use a non-toxic liquid and irrigate the eye. 53. The nurse and unlicensed assistive personnel, UAP, are caring for a minimally responsive client diagnosed with multiple sclerosis who weighs more than 400 pounds. Which action is priority when moving the client in the bed? 1. Obtain a lifting device made for lifting heavy clients. 2. Do not attempt to move the client because of the weight. 3. Get another UAP to help move the client in the bed. 4. Tell the family that the client must assist in moving in the bed. 54. The terminally ill client diagnosed with ALS, Lou Gehrig's disease, has a DNR order in place and is currently complaining of pain all over. The nurse notes the client has shallow breathing and AP67, R8, B/P104/62. Which intervention should the nurse implement? 1. Administer the narcotic pain medication IVP. 2. Turn and reposition the client for comfort. 3. Refuse to administer pain medication. 4. Notify the HCP of the client's vital signs. 55. The nurse in a rehabilitation facility is evaluating the progress of a female client who sustained a C6, C7 spinal cord injury. Which outcome indicates the client is improving? 1. The client can maneuver the automatic wheelchair into the hallway. 2. The client states she will be able to return to work in a few weeks. 3. The client uses eye blinks to communicate yes and no responses. 4. The client's husband built a wheelchair ramp onto their house. 56. The nurse is triaging phone calls in a neurosensory clinic. Which client should the nurse contact first? 1. The client with Meniere's disease who is complaining of vertigo and tinnitus. 2. The client with otitis media with effusion complaining of feeling of fullness in the ear. 3. The client with external otitis who has serosanguineous drainage and otalgia. 4. The client with otoclarsosis who has bilateral hearing loss. 57. The nurse is planning care for the client diagnosed with Parkinson's disease, PD. Which client problem is priority? 1. Altered nutrition. 2. Altered mobility. 3. Altered elimination. 4. Altered body image. 58. A client comes to the emergency department after having bleach splash in the eyes. Which intervention should the nurse implement first? 1. Cover both the eyes with sterile patches. 2. Assess the client's visual acuity. 3. Irrigate the eyes with sterile solution. 4. Elevate head of bed 45 degrees. 59. The 24-year-old client diagnosed with a traumatic brain injury is being transferred to a rehabilitation unit. Which healthcare provider order should the nurse question? 1. Physical therapy to work on lower extremity strength daily. 2. Occupational therapy to work on cognitive functioning BID. 3. A soft diet with mechanical ground meats and thickening agent in fluids. 4. Methylprednisolone, solumedrol, a steroid, IVPQ 6 hours. 180. Prioritization, delegation, and management of care for the NCLEX-RN registered exam 60. The rehabilitation nurse is planning the discharge of a 68-year-old client whose status post-subarachnoid hemorrhage includes residual speech and balance deficits. Which referral should the nurse initiate at this time? 1. Referral to a hospice organization. 2. Referral to the speech therapist. 3. Referral to the physical therapist. 4. Referral to a home health agency. 61. The client is postoperative a right eye enucleation. Which statement indicates the client needs more discharge teaching? 1. It will be approximately 2 weeks before I can get a prosthetic eye. 2. I can show you how to insert the conformer in the socket in case it falls out. 3. I should insert the eye drops into the lower conjunctiva of my eye. 4. If I develop an increased temperature I should call my healthcare provider. 62. The nurse is caring for a client newly diagnosed with multiple sclerosis. Which referral is appropriate at this time? 1. To a social worker to apply for disability. 2. To a dietitian for a nutritional consult. 3. To a psychological counselor for therapy. 4. To a chaplain to discuss spiritual issues. 63. The nurse and LPN have been assigned to care for clients on a neurology unit. Which nursing task is most appropriate to assign to the LPN? 1. Administer the adrenocorticotropic hormone to the client with multiple sclerosis. 2. Take the vital signs for the client who is experiencing status epilepticus. 3. Assist the client with Parkinson's disease to ambulate to the bathroom. 4. Assess the client newly admitted who has pneumonia and restless leg syndrome. 64. The nurse is administering medications on a neurological unit. Which medication should the nurse administer first? 1. The osmotic diuretic to the client with a closed head injury. 2. The morning medications to the client scheduled for physical therapy. 3. The narcotic pain medication to a client with increased intracranial pressure. 4. The anticonvulsant gabapentin, Neurontin, to the client with restless legs syndrome. 65. The charge nurse observes the new graduate nurse delegating tasks to the unlicensed assistive personnel, UAP, and the UAP appears to be ignoring the graduate nurse. Which action should the charge nurse implement first? 1. Wait and observe how the graduate nurse handles the situation. 2. Tell the UAP to get busy and complete the assigned tasks. 3. Discuss learning to assert authority with the new graduate. 4. Informally counsel the UAP about the response to the nurse. Chapter 7 Neurological Management 181 Question 66. The nurse is on the day shift of a rehabilitation unit. Given the medication administration record, MAR, below, which medication should the nurse administer first? 182 Prioritization, Delegation, and Management of Care for the NCLEX-RN Registered Exam Client Name, DF. Height, 69 inches. Date, today. Signature / initials. Account number, 925 645. Weight in pounds, 178. Weight in kg, 80.9. Medication Synthroid 0.7. 5 mg per daily. Ms. Contin, morphine sulfate, 30 mg per bid. Fleets enema per rectum. Q day. Metformin, glucophage, 850 mg per bid. Allergies, penicillin. Date of birth, May 7, 1955. 0701 to 1500. Day nurse RN/DN 2301 to 0700. Night nurse RN/NN 1501 to 2301. Administer the Synthroid. 2. Administer the MS Contin. 3. Administer the Fleets enema. 4. Administer the metformin. 67. The client on the rehabilitation unit post motor vehicle accident has been prescribed 50 mg of baclofen, lioresal, per dose orally for muscle spasms. Baclofen comes in 10 mg, 20 mg, and 75 mg tablets. How many tablets should the nurse administer and in which quantity? 68. The 19-year-old client is in the rehabilitation unit following a traumatic brain injury. Which intervention should the nurse delegate to the unlicensed assistive personnel, UAP? Select all that apply. 1. Make safety rounds hourly. 2. Refer the client to a college and career counselor. 3. Assist the client with meals. 4. Clamp and unclamp the indwelling catheter every 2 hours. 5. Discuss discharge placement with the parents. 69. The 69-year-old client post, right cerebral vascular accident, CVA, is on the rehab unit with left-sided weakness. Where should the nurse place the quadruplex cane when assisting the client to ambulate? Chapter 7 Neurological Management 183 Questions A, B, C, D. 1. A2. B3. C4. D70. The male client is in the emergency department after a fall, resulting in a closed head injury. The admitting nurse notes the client responds by opening his eyes and pushing the nurse's arm away when painful stimuli is applied, but does not make any verbal response. Which rating on the Glasgow Coma scale should be documented by the nurse? 184 Prioritization, Delegation, and Management of Care for the NCLEX-RN Registered Exam Glasgow Coma Scale Appropriate Stimulus Response Score Eyes Open * Approach to Bedside * Verbal Command * Pain Best Verbal Response Verbal Questioning with Maximum Arousal Best Motor Response Verbal Command Pain Pressure on Proximal Nail Bed Spontaneous response opens eyes to name on command lack of opening of eyes to previous stimuli but opens to pain lack of opening of eyes to any stimulus untestable oriented to person, place, time, and events confusion, conversant but disoriented disorganized. Use of words incomprehensible words, groaning lack of sound even with painful stimuli untestable follows verbal command localizes pain, attempts to remove offending stimulus flexion withdrawal of arm in response to pain without abnormal posturing abnormal flexion, flexing of arm at elbow and pronation, making a fist abnormal extension, extension of arm at elbow with adduction, and internal rotation of arm at shoulder lack of response untestable 4321054321065 4321001. Clients scored a 12 on the Glasgow Coma Scale. 2. Clients scored a 10 on the Glasgow Coma Scale. 3 clients scored an 8 on the Glasgow Coma Scale. 4 clients scored a 6 on the Glasgow Coma Scale. Chapter 7 Neurological Management 185 Clinical Scenario MR. Leo is the head nurse on the 10-bed neurological intensive care unit and 20-bed neurological step-down unit. He supervises 15 nurses in the ICU, along with 30 nurses and 15 UAPs. 1. Elizabeth, who is the day staff nurse, and the UAP are caring for a client with a right-sided cerebrovascular accident, CVA, with hemiparalysis. Which action by the UAP requires Elizabeth to intervene? 1. The UAP places the call light on the client's left side. 2. The UAP assists the client to eat the breakfast meal. 3. The UAP uses the draw sheet to move the client up in bed. 4. The UAP places a small pillow under the client's left shoulder. 2. The client diagnosed with a right-sided cerebrovascular accident, CVA, is complaining of a severe headache. Which intervention should Elizabeth implement first? 1. Administer acetaminophen, a narcotic analgesic. 2. Prepare for stat-computed tomography, CT, scan. 3. Notify the client's healthcare provider. 4. Assess the client's neurological status. 3. Courtney is caring for the following clients on the neurological intensive care unit. Which client should Courtney assess first? 1. The client with a C6-SI who is complaining of dyspnea and has crackles in the lungs. 2. The client with Guillain-Barré syndrome who is complaining ascending paralysis. 3. The client with traumatic brain injury who has a Glasgow Coma Scale score of 6. 4. The client diagnosed with a cerebrovascular accident, CVA, who has expressive aphasia. 4. The ICU unit is very busy and MR. Leo is transcribing the healthcare provider's admission orders for a client with a closed head injury. Which medication order should Mr. Leo question? 1. A subcutaneous anticoagulant. 2. An intravenous osmotic diuretic. 3. An intravenous anticonvulsant. 4. An intravenous proton pump inhibitor. 5. Jesse is caring for a client who had a C6-SI 2 years ago and is admitted for stage 4 pressure ulcers in the coccyx area. The client is complaining of a severe headache and the B/P is 190/110. Which intervention should Jesse implement first? 1. Insert a urinary catheter into the client. 2. Complete a neurological assessment. 3. Put the client in Trendelenburg position. 4. Palpate the client's bladder. 6. Mr. Leo is making rounds and as he enters the room the client is having tonic-clonic seizure. Which priority intervention should Mr. Leo implement? 1. Place the client on the side. 2. Call the rapid response team. 3. Determine if the client is incontinent of urine. 4. Provide the client with privacy during the seizure. 7. The UAP is attempting to put an oral airway in the mouth of a client having a tonic-clonic seizure. Which intervention should Mr. Leo take first? 1. Complete an adverse occurrence report. 2. Instruct the UAP to stop inserting the oral airway. 3. Assist the UAP to insert the oral airway. 4. Note the time of the seizure and observe seizure. Neurological Clinical Scenario 8. MR. Leo is telling one of his graduate nurses the correct procedure for assisting the healthcare provider with a lumbar puncture to R/O meningitis. Which interventions should Mr. Leo discuss with the graduate nurse? Select all that apply. 1. Obtain an informed consent from the client or significant other. 2. Determine if the client is allergic to iodine or shellfish. 3. Place the client in the supine position with the foot of the bed elevated. 4. Instruct the client to relax and breathe normally. 5. Explain to the client what to expect during the procedure. 9. Mr. Leo is making shift assignments. Which client should be assigned to the most experienced nurse? 1. The client diagnosed with bacterial meningitis who is experiencing photophobia. 2. The client with an L4-SI who has spastic muscle spasms of the lower extremities. 3. The client diagnosed with Parkinson's who has a mask-like face and has pill rolling. 4. The client amyotrophic lateral sclerosis, ALS, who is having respiratory distress. 10. The nurse is caring for clients on a neurological intensive care unit. Which client should be assessed first? 1. The client with increased intracranial pressure whose Glasgow Coma scale went from 11 to 14. 2. The client diagnosed with AC6I who has bradycardia, hypotension, and hyperflexia. 3. The client with a brainstem herniation whose big toe moves toward the top surface of the foot and the other toes fan out after the sole of the foot has been firmly stroked. 4. The client diagnosed with West Nile virus who has a temperature of 101.2 degrees Fahrenheit and generalized body aches. 186. Prioritization, delegation, and management of care for the NCLEX-RN registered exam. The correct answer number and rationale for why it is the correct answer are given in boldface type. Rationales for why the other possible answer options are incorrect also are given, but they are not in boldface type. 1. The serum platelet level is within the normal range of 150,000 to 400,000 ml, therefore, this laboratory does not warrant intervention by the charge nurse. 2. A therapeutic Depakote level is 50 to 100 Ug/ml, therefore, this laboratory result does not warrant action by the nurse. 3. Steroids, such as prednisone, elevate a client's blood glucose level, therefore, this does not warrant intervention by the nurse. 4. The therapeutic range for Dilantin is 10 to 20 mg/dl. This client's higher level warrants intervention because the serum level is above therapeutic range. Content, medical/surgical, category of health alteration, neurological, integrated processes, nursing process, assessment, client needs, safe and effective care environment, management of care, cognitive level, analysis making nursing decisions. The nurse must be knowledgeable of normal laboratory values. These values must be memorized and the nurse must be able to determine if the laboratory value is normal for the client's disease process or medications the client is taking. 2.1. A pain medication is important to administer in a timely manner, but its administration is not priority over a medication that must be administered on time to prevent respiratory complications. 2. A steroid medication is not priority over a client who may experience respiratory difficulty. Steroids must be given to prevent adrenal sufficiency, but it does not have to be administered first. 3. Anticholinesterase medications administered for myasthenia gravis must be administered on time to preserve muscle functioning, especially the functioning of the muscles of the upper respiratory tract. This is the priority medication. 4. Clients who have called for medications should be attended to, but this client would not receive an antacid for heartburn before the client diagnosed with myasthenia gravis or the client in pain. Content, medical/surgical, category of health alteration, neurological, integrated processes, nursing process, implementation, client needs, physiological integrity, pharmacological and parenteral therapies, cognitive level, analysis making nursing decisions. The nurse must be aware of expected actions of medications, and assess data indicating whether the medication is effective or the medication is causing a side effect or an adverse effect. 3.1. The nurse would expect the client with Guillain-Barré syndrome to have ascending paralysis and the problem has just reached the knees, so the nurse should not need to assess this client first. 2. The client with AC6I is expected to have autonomic dysreflexia, but it is an emergency situation, therefore, the nurse should assess this client first. 3. Pill rolling, a hand tremor wherein the thumb and forefinger appear to move in a rotary fashion as if rolling a pill, is an expected clinical manifestation of Parkinson's, therefore, the nurse would not assess this client first. 4. The client with Huntington's disease has chorea, which includes abnormal and excessive involuntary movements, therefore, this client would not be assessed first. Content, medical/surgical, category of health alteration, neurological, integrated processes, nursing process, assessment, client needs, safe and effective care environment, management of care, cognitive level, comprehension making nursing decisions. The nurse must determine which sign/sy symptom is not expected for the disease process. If the sign/symptom is not expected or it is an emergency situation, then the nurse should assess the client first. This type of question is determining if the nurse is knowledgeable of signs/symptoms of a variety of disease processes. 4.1. Placing a gait belt prior to ambulating is an appropriate action for safety and would not require the nurse to intervene. 2. Placing the client in a prone position helps promote hyperextension of the hip joints, which is essential for normal gait and helps prevent knee and hip flexion contractures. Therefore, this would not require the nurse to intervene. Answers and Rationales Chapter 7 Neurological Management 187 Answers 188 Prioritization, Delegation, and Management of Care for the NCLEX-RN Registered Exam 3. This action is inappropriate and would require intervention by the nurse because pulling on a flexed shoulder joint could cause shoulder dislocation. The client should be pulled up by placing the arm underneath the client's back or using a lift sheet. 4. The client should be encouraged and praised for attempting to perform any activities independently, such as combing hair or brushing teeth. Content: medical/surgical, category of health alteration, neurological, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, application making nursing decisions. The nurse must ensure the UAP can perform any tasks that are delegated. It is the nurse's responsibility to demonstrate and/or teach the UAP how to perform the task, and evaluate the task. 5.1. Because the client is having an evolving stroke, the client is experiencing a worsening of signs/symptoms over several minutes to hours. Thus, the client is at risk for dying and should be cared for by the most experienced nurse. 2. A transient ischemic attack by definition lasts less than 24 hours, thus, this client should be stable at this time. 3. Pain is expected in clients with Guillain-Barré syndrome, and symptoms typically occur on the lower half of the body, which wouldn't affect the airway. Therefore, a less experienced nurse could care for this client. 4. The charge nurse could assign this client to an unlicensed assistive personnel, UAP. Content: medical/surgical, category of health alteration, neurological, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis making nursing decisions. When the nurse is deciding which client shall be assigned to the most experienced nurse, the most critical and unstable client should be assigned to the most experienced nurse. 6.1. This client should be referred to an inpatient rehabilitation facility for intensive therapy before deciding on long-term placement, home with home health care or a long-term care facility. The initial rehabilitation a client receives can set the tone for all further recuperation. This is the appropriate referral at this time. 2. A home health care agency may be needed when the client returns home, but the most appropriate referral is to a rehabilitation center where intensive therapy can take place. 3. A long-term care facility may be needed at some point, but the client should be given the opportunity to regain as much lost ability as possible at this time. 4. The outpatient center would be utilized when the client is ready for discharge from the inpatient center. Content: medical/surgical, category of health alteration, neurological, integrated processes, nursing process, planning, client needs, physiological integrity, physiological adaptation, cognitive level, synthesis making nursing decisions. The nurse must be knowledgeable of the role of all members of the multidisciplinary healthcare team, as well as HIPAA rules and regulations. These will be tested on the NCLEX-RN registered exam. 7.1. The nurse should be the first one to feed the client in order for the nurse to evaluate the client's ability to swallow and not ASPI rate. 2. The LPN could administer routine parenteral medications. This is the best task to assign to the LPN. 3. This involves assessing the client, therefore, the nurse should not delegate this assignment to the LPN. 4. Teaching is the responsibility of the RN. Content: medical/surgical, category of health alteration, neurological, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis making nursing decisions. The nurse cannot assign assessment, teaching, evaluation, or an unstable client to a LPN. The LPN can transcribe HCP orders and can call HCPs on the phone to obtain orders for a client. 8. 1 and 2 are correct. 1. Checking the client's skin involves assessment, therefore, the nurse cannot delegate this assignment to the UAP. 2. The nurse cannot delegate medication administration to a UAP. 3. The UAP can perform routine hygiene care. The nurse must then make the time to assess the client's skin. 4. The UAP can ambulate a client to the bathroom. 5. The UAP can take routine vital signs. Content: management of care, category of health alteration, neurological, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis. Chapter 7 Neurological Management 189 Making Nursing Decisions. Th. Is a type of alternate question included in the NCLEX-RN registered. The nurse must be able to select all the options that answer the question correctly. There are no partial correct answers. 9.1. The UAP cannot change abdominal dressings because the incision must be assessed for healing. 2. The UAP cannot check the client's foresight. Remember, check is assess. 3. The nurse must monitor the vital signs on a client recently returned from surgery to determine whether the client is stable. The UAP can take vital signs and report results to the nurse. 4. The UAP can escort the client to the vehicle after discharge. Content: management of care, category of health alteration, neurological, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis making nursing decisions. A nurse cannot delegate assessment, teaching, ng, evaluation, medications, or an unstable client to a UAP. Tasks that cannot be delegated are nursing interventions requiring nursing judgment. 10.1. This client with dyspnea and a respiration rate of 12 has signs/symptoms of a respiratory complication and should be assessed first because ascending paralysis at the C6 level could cause the client to stop breathing. 2. This is a psychosocial need and should be addressed, but it is not priority over a physiological problem. 3. A client with a lower psi would not be at risk for autonomic dysreflexia, therefore, a complaint of headache and feeling hot would not be priority over an airway problem. 4. The client with a pulse oximeter reading greater than 93% is receiving adequate oxygenation. Content: medical/surgical, category of health alteration, neurological, integrated processes, nursing process, assessment, client needs, safe and effective care environment, management of care, cognitive level, analysis making nursing decisions. When deciding which client to assess first, the test taker should determine whether the signs/symptoms the client is exhibiting are normal or expected for the situation. After eliminating the expected options, the test taker should determine which situation is more life-threatening. 11.1. The client is experiencing autonomic dysreflexia, a complication of psi above the T6, and the most common cause is a full bladder. Placing the client on telemetry is not the nurse's first intervention. 2. Completing a neurological assessment is an intervention a nurse could implement, but it should not be the first for a client experiencing autonomic dysreflexia. 3. Autonomic dysreflexia is a life-threatening condition and can be considered a medical emergency requiring immediate attention. The nurse should not assess but should intervene, and the most common cause is a full bladder. 4. A CT scan of the head would be appropriate if the elevated B/P was secondary to a CVA, not due to a complication of a PSI. Content: medical/surgical, category of health alteration, neurological, integrated processes, nursing process, assessment, client needs, physiological integrity, reduction of risk potential, cognitive level, analysis. Making nursing decisions. When the test question asks the test taker to determine which intervention should be implemented first, it means that all the options are something a nurse could implement. The test taker should apply the nursing process. If the client is in distress, then do not assess, the nurse should do something to help the client. 12.1. It would be appropriate for the UAP to perform ROM exercises to help prevent contractures, therefore, this action would not require the nurse to intervene. 2. This is not an appropriate intervention because the client is at risk for increased intracranial pressure, ICP. Therefore, the client should not be placed on the stomach. The prone position helps promote hyperextension of the hip joints, which is essential for normal gait and helps prevent knee and hip flexion contractures, and done in rehabilitation. 3. The client should be pulled up in bed by placing the arm underneath the back or using a lift sheet, therefore, the nurse would not need to intervene. 4. The client should be encouraged and praised for attempting to perform any activities independently, such as combing hair, brushing teeth, or feeding him or herself. The nurse would not need to intervene. Content: medical/surgical, category of health alteration, neurological, integrated processes, nursing process, implementation, client needs, physiological integrity, reduction of risk potential, cognitive level, analysis. Answers 190. Prioritization, delegation, and management of care for the NCLEX-RN registered exam. Making nursing decisions, the nurse must ensure the UAP can perform any tasks that are delegated. It is the nurse's responsibility to demonstrate and/or teach the UAP how to perform the task, and evaluate the task. 13.1. The less experienced nurse could care for the client on a ventilator and console the family as needed. This client is not in a life-threatening situation and is stable for the condition. 2. A client with increased intracranial pressure requires a more experienced critical care nurse. 3. This client is unstable and requires a more experienced critical care nurse. 4. Status epilepticus is a state of continuous seizure activity and is the most serious complication of epilepsy. This is a neurological emergency. This client should be assigned to a more experienced nurse. Content: medical/surgical, category of health alteration, neurological, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis. Making nursing decisions, the most stable client should be assigned to the graduate nurse. The more critical clients should be assigned to the more experienced nurses. 14.1. Purposeful movement following painful stimuli would indicate an improvement in the client's condition and would not warrant intervention by the nurse. 2. Extension of the upper and lower extremities is assuming a decerebrate posture, which indicates the client's intracranial pressure, ICP, is increasing. This would warrant immediate intervention by the nurse. 3. Aimless thrashing would indicate an improvement in the client's condition and would not warrant intervention by the nurse. 4. If the client is able to follow simple commands, then the client's condition is improving and would not warrant intervention by the nurse. Content: medical/surgical, category of health alteration, neurological, integrated processes, nursing process, assessment, client needs, safe and effective care environment, management of care, cognitive level, synthesis. Making nursing decisions, the test taker should ask, are the assessment data normal for the disease process? If they are normal for the disease process, then the nurse would not need to intervene. If they are not normal for the disease process, then this warrants intervention by the nurse. 15.1. An adverse occurrence report is completed for incidents occurring to clients. 2. The nurse should talk to the primary nurse, but the sharps container should be changed immediately. 3. The UAP can change a sharps container. This must be done because a sharps container above the fill line is a violation of Occupational Safety Health Administration, OSHA, rules and can result in a financial fine. 4. The infection control nurse does not need to be notified of this situation. Content, legal, category of health alteration, neurological, integrated processes, nursing process, implementation, client needs, safe and effective care environment, safety and infection control, cognitive level, application making nursing decisions. The nurse is responsible for knowing A and D complying with local, state, and federal standards of care. 16.1. The nurse should address the client's comment and not pass the buck to someone else. 2. The nurse should address the client's statement and not attempt to problem solve at this point in the conversation. 3. The nurse is reflecting the client's comments, which will encourage the client to ventilate her feelings. This is the most appropriate response. 4. This is false reassurance and an inappropriate response to the client's statement. Content, medical/surgical, category of health alteration, oncology, integrated processes, nursing process, implementation client needs, psychosocial integrity, cognitive level, application making nursing decisions. The NCLEX-RN registered blueprint includes therapeutic communication as a subcategory of psychosocial integrity. The nurse should allow clients and family to ventilate feelings. 17.1. The client with Guillain-Barré syndrome is at risk for airway compromise resulting from the ascending paralysis. Cardiac output is not a priority. 2. The client's psychological needs are important, but psychosocial problems are not priority. 3. Complications of immobility are pertinent but do not take priority over the airway. Chapter 7 Neurological Management 191.4. Guillain-Barré syndrome produces ascending paralysis that will cause respiratory failure, therefore, breathing pattern is priority. Content, medical/surgical, category of health alteration, neurological, integrated processes, nursing process, planning, client needs, physiological integrity, reduction of risk potential, cognitive level, comprehension making nursing decisions. The NCLEX-RN registered integrates the nursing process throughout the client needs categories and subcategories. The nursing process is a scientific, clinical reasoning approach to client care that includes assessment, analysis, planning, implementation, and evaluation. The nurse will be responsible for identifying nursing problems for clients. 18.1. The occupational therapist addresses assisting the client with ADLS, but with MG the client will have no problems with ADLS if the client takes the medication correctly, 30 minutes prior to performing ADLS. 2. A physical therapist addresses transfer and movement issues with the client, but this would not be priority in the critical care unit. 3. The social worker assists the client with discharge issues or financial issues, but this would not be appropriate for the client in the critical care unit. 4. Speech therapists address swallowing problems, and clients with MG are dysphagic and are at risk for aspiration. The speech therapist can help match food consistency to the client's ability to swallow and thus help enhance client safety. This referral would be appropriate in the critical care unit. Content, medical/surgical, category of health alteration, neurological, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, comprehension making nursing decisions. The NCLEX-RN registered integrates the nursing process throughout the client needs categories and subcategories. The nursing process is a scientific, clinical reasoning approach to client care that includes assessment, analysis, planning, implementation, and evaluation. The nurse will be responsible for identifying nursing diagnoses for clients. 19.1. This should be done but not prior to notifying the charge nurse and reporting the incident. 2. The nurse should notify the charge nurse first so the hospital protocol can be followed, including notifying the infection control nurse, completing an incident report, obtaining blood from the client, and starting prophylactic medication if warranted. 3. This should be done within 4 hours of the stick, but the charge nurse should be notified first so that proper hospital protocol can be initiated. 4. This is done at 3 months and 6 months. Content: medical/surgical, category of health alteration, neurological, integrated processes, nursing process, implementation, client needs, safe and effective care environment, safety and infection control, cognitive level, application making nursing decisions, the NCLEX-RN registered blueprint in CLUD's nursing care that is ruled by legal requirements as well as the Joint Commission, Centers for Medicare and Medicaid Services, the Centers for Disease Control and Prevention, and Occupational Safety and Health Administration rules and regulations. The nurse must be knowledgeable of these standards. 21. The client diagnosed with Parkinson's disease who has begun to hallucinate may be experiencing an adverse reaction to one of the medications used to treat the disease. The nurse should assess this client first. 2. Peripheral edema is expected in a client diagnosed with heart failure. This client does not need to be assessed first. 3. Wandering and lack of sleeping are expected in a client diagnosed with Alzheimer's disease. This client does not need to be assessed first. 4. Weight loss in a client diagnosed with terminal cancer is expected. The nurse should review the client's intake, food preferences, and pain control before making an intervention. Weight loss does not occur in a matter of minutes to hours, and this client's needs do not merit assessment before the client with a new problem. Content: management of care, category of health alteration, neurological, integrated processes, nursing process, assessment, client needs, safe and effective care environment, management of care, cognitive level, analysis making nursing decisions. The nurse should determine whether a new problem is occurring or whether the problem is expected for the disease process. If the symptom is expected for the disease process and it is not life-threatening, then that client does not have priority. 21.1. A daily aspirin is not a priority medication. This medication can be administered within Answers 192 Prioritization, Delegation, and Management of Care for the NCLEX-RN registered exam 30 minutes before or 30 minutes after the scheduled time. 2. Prostigmin promotes muscle function in clients diagnosed with myasthenia gravis. This medication should always be administered on time to prevent loss of muscle tone, especially the muscles of the upper respiratory tract. This is the priority medication to administer at this time. 3. An oral antibiotic can be administered within 30 minutes before or after the scheduled time frame. 4. Acyclovir, Zovirox, alone or in combination with prednisone may be used to treat Bell's palsy, but this medication is not a priority medication. Content: adult health, pharmacology, category of health alteration, neurological, integrated processes, nursing process, implementation, client needs, physiological integrity, pharmacological and parenteral therapies, cognitive level, analysis making nursing decisions. When the nurse is deciding on a priority medication, the test taker must first decide on the expected response of the client. If the expected response prevents or treats an emergency situation, then that medication becomes the priority medication to administer. 22.1. Clients diagnosed with Alzheimer's disease may have problems with completing activities of daily living, but this is not the client's priority problem. 2. Safety is the highest priority for clients diagnosed with end-stage Alzheimer's disease because the client is unaware of his or her own surroundings and can easily wander from an area of safety. 3. The client in end-stage disease may have an increased risk for constipation, but this is not priority over safety of the client. 4. The client's family is often distraught over seeing their loved one deteriorate because of Alzheimer's, but it is not priority over the safety of the client. Content: management of care, category of health alteration, neurological, integrated processes, nursing process, planning, client needs, physiological integrity, physiological adaptation, cognitive level, synthesis making nursing decisions. The test taker can use Maslow's hierarchy of needs to determine the correct answer. On the pyramid of needs, beginning at the bottom, physiological needs have priority, followed by safety. 23.1. Cataracts cause less light to be filtered through an opaque lens to the retina. The client should have as much light as possible in the home to prevent falls. 2. Dark glasses protect the eyes from the sun's rays when outside, as they do for anyone, but this client needs more light indoors. 3. This is the responsibility of the HCP, not the nurse. 4. The furniture in the client's house should not be moved. If the furniture is left in its usual position, the client will be less likely to fall or stumble. However, the priority intervention is safety when walking, therefore, increasing light in the home is priority. Content: geriatrics, category of health alteration, neurological, integrated processes, nursing process, planning, client needs, physiological integrity, reduction of risk potential, cognitive level, synthesis making nursing decisions. This question requires the test taker to use knowledge of the disease process and Maslow's hierarchy of needs. Cataracts cause opacity of the lens of the eye, and safety is a high priority according to Maslow. 24.1. The nurse should first assess the client's neurological status. It is not normal for an elderly person to have a change in behavior. This is cause for assessment. 2. The nurse may need to notify the HCP but not prior to completing a neurological assessment. 3. The nurse should first assess the client prior to further interviewing the client's wife. 4. The nurse could determine the last time the client ate, since the confusion could be due to hypoglycemia, but the first intervention is to complete a neurological assessment. Content: medical/surgical, category of health alteration, neurological, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, analysis making nursing decisions. Anytime the nurse receives information about a client who may be experiencing a complication, the nurse must assess the client. The nurse should not make decisions about the client's needs based on another staff member's information. 25.1. This question will determine whether the nurse has assessed the client's ability to swallow. The nurse cannot delegate unstable clients, and a client newly diagnosed with a CVA may be unstable and have difficulty swallowing. 2. This question does not address the client's ability to swallow. Chapter 7 Neurological Management 193.3. Thicket might be needed if the client has difficulty swallowing, but the charge nurse has not established that the client has swallowing difficulty. 4. A UAP can feed clients who are stable and do not require nursing judgment during the process. Content: medical/surgical, category of health alteration, neurological, integrated processes, nursing process, analysis client needs, safe and effective care environment, safety and infection control, cognitive level, analysis making nursing decisions. The nurse cannot delegate assessment, evaluation, teaching, administering medications, or the care of an unstable client to a UAP. 26.1. The client should be encouraged to move the buttocks to increase blood circulation to the area, but a wheelchair cushion used every time the client is in the wheelchair will help prevent pressure ulcers. 2. A high-protein diet will assist with maintaining a positive nitrogen balance that will support wound healing, but it will not prevent pressure from causing a breakdown of the skin. 3. All clients remaining in a wheelchair for extended periods of time should have a wheelchair cushion that relieves pressure to prevent skin breakdown. 4. The more the client can move from the wheelchair to a chair to the bed, the more it will help decrease the possibility of a pressure ulcer, but a wheelchair cushion helps relieve pressure continuously. Content: medical/surgical, category of health alteration, neurological, integrated processes, nursing process, implementation, client needs, physiological integrity, basic care and comfort, cognitive level, comprehension. Making nursing decisions, the nurse must be knowledgeable of expect D. Medical treatment for the client. This is a knowledge-based, or comprehension, question. 27.1. Identifying the first area that began seizing will provide information and clues as to the location of the seizure origin in the brain, but it is not the nurse's first intervention. 2. The nurse should first look at his or her watch and time the seizure. Assessment is the first intervention because there is no action the nurse can implement to stop or intervene with the seizure. 3. The client's bed rails should be padded, but this is not the first intervention when walking into a room where the client is beginning to have a seizure. The nurse should first assess the seizure and then pad the side rails if there is time. The seizure may be over by the time the nurse can pad the side rails. 4. The client should be protected from onlookers, but the nurse should always assess and care for the client first. Content: medical/surgical, category of health alteration, neurological, integrated processes, nursing process, implementation, client needs, safe and effective care environment, safety and infection control, cognitive level, analysis. Making nursing decisions, the nurse should always apply the nursing process when answering a question requiring the nurse to determine which intervention to implement first. The first part of the nursing process is to assess. 28.1. Closing the door and cubicle curtain protects the client's privacy and would not warrant immediate intervention from the nurse. 2. Providing a back massage is a wonderful action to take and would not warrant intervention by the nurse. 3. Checking the temperature of the bath water prevents scalding the client with water that is too hot or making the client uncomfortable with water that is too cold. This action would not warrant immediate intervention. 4. The client is recovering from a potentially debilitating disease, and in the rehabilitation unit the client should be out of the bed as much as possible. Bathing the client in bed would warrant intervention by the nurse. Content: medical/surgical, category of health alteration, neurological, integrated processes, evaluation, client needs, physiological integrity, reduction of risk potential, cognitive level, synthesis. Making nursing decisions, delegation means the nurse is responsible for the UAP's actions and performance. The nurse must correct the UAP's performance to ensure the client is cared for safely in the hospital, the rehabilitation unit, or the home. 29.1, 2, 3, and 4 are correct. 1. Placing a small pillow under the shoulder will prevent the shoulder from adducting toward the chest and developing a contracture. 2. The client should be referred to occupational therapy for assistance with performing activities of daily living, ADLS. 3. The client should not ignore the paralyzed side, and the nurse must encourage the client to move it as much as possible. Answers 194. Prioritization, delegation, and management of care for the NCLEX-RN registered exam. A written schedule may assist the client in exercising. 4. These exercises should be done at least 5 times a day for 10 minutes at a time to help strengthen the muscles used for walking. 5. The fingers should be positioned so that they are barely flexed, to prevent contracture. Content: medical/surgical, category of health alteration, neurological, integrated processes, nursing process, planning, client needs, health promotion and maintenance, cognitive level, synthesis. Making nursing decisions, this is an alternate type of question included in the NCLEX-RN registered. The nurse must be able to select all the options that answer the question correctly. There are no partially correct answers. 31. The nurse should stabilize the client's cervical spine to help prevent a spinal cord injury, or the patient's spine can sustain irreparable damage during movement. 2. Unless the driver is in danger, car on fire or in water, the nurse should not move the driver. 3. The nurse should first ensure a patent airway. According to Maslow's hierarchy of needs, airway is always priority. 4. The nurse should control external bleeding, but the first intervention is airway. Content: medical/surgical, category of health alteration, neurological, integrated processes, nursing process, implementation, client needs, physiological integrity, reduction of risk potential, cognitive level, analysis. Making nursing decisions, the test taker should use some tool as a.r. efference to guide in the decision-making process. In this situation, Maslow's hierarchy of needs should be applied. 31.1. This would be the most appropriate assignment because the nurse would not be exposed to any contagious diseases or dangerous radiological procedures. 2. The pregnant nurse should not be exposed to X-rays, which could endanger the fetus. 3. Working in the front desk triage area would allow the pregnant nurse to be exposed to any type of contagious or infectious disease. This is not an appropriate assignment. 4. The oncology clinic will have clients receiving chemotherapeutic agents that may endanger the fetus. This would not be the most appropriate assignment. Even if the nurse is not administering the medication, the most appropriate assignment is to assign the nurse to an area that poses no danger to the fetus. Content: medical/surgical, category of health alteration, neurological, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, application. Making nursing decisions, pregnant nurses should not and can refuse to perform duties that could harm the fetus. Most medications and many diagnostic tests and treatments can harm the fetus. 32.1. If the client must be transferred from the clinic to the hospital, then the client is unstable and therefore should not be assigned to a UAP. 2. The client is stable because he or she is being sent home, therefore, the UAP could safely complete this task. 3. Showing the client how to walk with crutches is teaching, and the nurse cannot delegate teaching to the UAP. 4. The UAP should not be calling a pharmacy because this is not within the scope of practice of unlicensed personnel. The HCP is responsible for delegating this task. Content: management of care, category of health alteration, neurological, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis. Making nursing decisions, a nurse cannot delegate assessment, teaching, NG, evaluation, medications, or an unstable client to a UAP. Tasks that cannot be delegated are nursing interventions requiring nursing judgment. 33.1. The nurse should first care for the client and refer the client to an HCP for possible X-rays, pain medication, and further treatment. The employee health nurse's responsibility is to ensure the employee is safe to work, and this client is not. 2. This information should be completed because any injury on the job must be covered by workers' compensation insurance so that all costs will be covered for the client. Documentation is never priority over caring for the client. 3. The employee health nurse should determine whether there are unsafe areas in the workplace or whether the employee was negligent, but this is not the nurse's first intervention. 4. The employee's supervisor does need to be notified, but this is not the nurse's first intervention. The safety of the client is always first. Content: medical/surgical, category of health alteration, neurological, integrated processes, nursing process, assessment, client needs, physiological integrity, reduction of risk potential, cognitive level, analysis. Making nursing decisions, when the question asks which intervention shall LDB Chapter 7 Neurological Management 195 implemented first, it means all the options are something a nurse could implement, but only one should be implemented first. The test taker should use the nursing process to determine the appropriate action. If the client is in distress, do not assess. If the client is not in distress, then the nurse should assess. 34.1. If a client is complaining of pain, the nurse should not ask the client to return to work. If nothing else, the client should be allowed to stay in the clinic until the pain subsides. 2. The employee must submit to a urine drug screen anytime there is an injury. This is standard practice by many employers to help determine whether the employee was under the influence during the time of the accident. Workers' compensation will not be responsible if the employee is under the influence of alcohol or drugs. 3. Because there are no visible injuries and the neurovascular assessment is normal, a referral to the emergency department is not warranted. The employee health nurse could send the employee home with further instructions. None of the complaints warrants the employees needing an X-ray. 4. A sequential compression device is used to help prevent deep vein thrombosis for clients on bed rest. This is not an appropriate intervention. Content: medical/surgical, category of health alteration, neurological, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, application making nursing decisions. The NCLEX-RN registered blueprint includes nursing care that is ruled by legal requirements as well as the Joint Commission, Centers for Medicare and Medicaid Services, Centers for Disease Control and Prevention, and Occupational Safety and Health Administration rules and regulations. The nurse must be knowledgeable of these standards. 35. 1. An alert client with a sucking chest wound should be categorized as red, priority 1, which means the injury is life-threatening but survivable with minimal intervention. These clients can deteriorate rapidly without treatment. 2. A client who cannot stop crying and cannot answer questions should be categorized as green, priority 3, which means the injury is minor and treatment can be delayed hours to days. These clients should be moved away from the main triage area. Clients with behavioral and psychological problems are included in this category. 3. A client whose abdomen is hard and tender should be categorized as a yellow, priority 2, which means the injury is significant and requires medical care but can wait hours without threat to life or limb. Clients in this category receive treatment only after immediate casualties are treated. 4. This client should be categorized as black, priority 4, which means the injury is extensive and chances of survival are unlikely even with definitive care. Clients should receive comfort measures and be separated from other casualties, but not abandoned. Content: medical/surgical, category of health alteration, neurological, integrated processes, nursing process, assessment, client needs, safe and effective care environment, management of care, cognitive level, analysis making nursing decisions. The NCLEX-RN registered blueprint includes questions on disaster management. The nurse needs to be aware of triaging clients, nursing care, and procedures and protocols during disasters. 36.1. The nurse should determine what medication the client has taken, but the nurse should first attempt to determine whether the headache is secondary to high blood pressure. 2. No matter what number the client identifies on the pain scale in the home setting, the nurse must attempt to determine the cause. One way to try to determine the cause or to eliminate a possible cause is to take the client's blood pressure. 3. If the client's blood pressure is not elevated, the client could take the non-narcotic analgesic acetaminophen, Tylenol, but if the client's blood pressure is elevated, the Tylenol will not help. 4. The number one risk factor for a CVA is arterial hypertension. Because the client has a history of a CVA and is complaining of a severe headache, which is a symptom of hypertension, the nurse should first take the client's blood pressure. If it is elevated, the client needs to be taken to the emergency department. In the home setting, asking about the pain scale would not affect the care the nurse provides. Content: medical/surgical, category of health alteration, neurological, integrated processes, nursing process, implementation, client needs, physiological integrity, reduction of risk potential, cognitive level, analysis making nursing decisions. When the question asks which intervention should be implemented, answers 196. Prioritization, delegation, and management of care for the NCLEX-RN registered exam. First, it means that all the options are something a nurse could implement, but only one should be implemented first. The test taker should use the nursing process to determine the appropriate action. If the client is in distress, do not assess. If the client is not in distress, then the nurse should assess. 37.1. The nurse should assist the client to lie in the C position with the back as near as possible to the edge of the bed, but it is not the first intervention. 2. The first intervention is to empty the client's bladder prior to the procedure. 3. All clients should have an advance directive, but it is not mandated by law, and clients can decide not to have one. 4. The client does not have to be NPO for this procedure. Content: medical/surgical, category of health alteration, neurological, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, analysis making nursing decisions. The nurse must be knowledgeable of norm-al diagnostic tests pre and post procedure. These interventions must be memorized, and the nurse must be able to determine if the client is able to have the diagnostic procedure and post-procedure care to ensure the client is safe. 38.1. A severe, pounding headache would be priority for a client with a T6 or above spinal cord injury, SI, because it could be autonomic dysreflexia, but not in a client with a lower level lesion. 2. The client's psychosocial need is not priority over clients with physiological problems. This client should not be visited first. 3. The client with Parkinson's disease is expected to have a short, shuffling gait, therefore, this client does not need to be seen first. 4. The client is reporting an infection at insertion sites into the bone, which can lead to osteomyelitis. This client is exhibiting a potentially life-threatening condition and should be seen first. Content: medical/surgical, category of health alteration, neurological, integrated processes, nursing process, assessment, client needs, safe and effective care environment, management of care, cognitive level, analysis making nursing decisions. When deciding which client to assess first, the test taker should determine whether the signs/symptoms the client is exhibiting are normal or expected for the client's situation. After eliminating the expected option, the test taker should determine which situation is more life-threatening. 39.1. A client with AIDS would be expected to have Kaposi sarcoma, therefore, this client would not need to be visited first. 2. A client with dementia would be expected to have difficulty dressing, therefore, this client would not need to be visited first. 3. The classic feature of trigeminal neuralgia is excruciating pain described as a burning, knife-like, or lightning-like shock in the lips, upper or lower gums, cheek, forehead, or side of the nose. The nurse would not return this call first since the client is experiencing the normal signs/symptoms for the disease process. 4. Botulism is the most serious type of food poisoning and the client is exhibiting signs/symptoms of it, therefore, the nurse should return this phone call first. Content: medical/surgical, category of health alteration, neurological, integrated processes, nursing process, assessment, client needs, safe and effective care environment, management of care, cognitive level, analysis making nursing decisions. When deciding which client to assess first, the nurse should determine whether the signs/symptoms the client is exhibiting are normal or expected for the client's situation. After eliminating the expected options, the test taker should determine which situation is more dangerous for the client. 41. Therapeutic communication addresses the client's feelings and attempts to allow the client to verbalize feelings. The client is still grieving over her loss, and the nurse should let her vent feelings. 2. The social worker may be able to help the client with driving and going back to college, but this is not the nurse's first intervention. 3. The American Spinal Cord Association is an excellent resource for clients with spinal cord injuries, but the client is still grieving, and the nurse should allow the client to express her feelings. 4. Attempting to help identify a support system for the client is an appropriate intervention, but the first intervention is to allow the client to vent her feelings. Content: medical/surgical, category of health alteration, neurological, integrated processes, nursing process, implementation, client needs, psychosocial integrity, therapeutic communication, cognitive level, analysis. Chapter 7 Neurological Management 197 Making Nursing Decisions. The NCLEX-RN registered blueprint includes therapeutic communication as a subcategory of psychosocial integrity. The nurse should allow clients and family to ventilate feelings. 41.1. The client is allergic to iodine, therefore, the client cannot have the CT scan with contrast because it is iodine. The nurse should question this HCP order. 2. The client is not allergic to Tylenol, therefore, this order should not be questioned. 3. The client should have vital signs taken, therefore, this order should not be questioned. 4. A low-fat, low-cholesterol diet would be appropriate for this client. Content: medical/surgical, category of health alteration, neurological, integrated processes, nursing process, analysis, client needs, physiological integrity, reduction of risk potential, cognitive level, analysis. Making nursing decisions. When the STEM asks the nurse to determine which healthcare provider's order to question, the test taker should realize this is an accept question. 3 of the options are appropriate for the HCP to prescribe and 1 is not appropriate for the client's disease process or procedure. 42.1. The client has a chronic illness. The nurse should empower the client to deal with her disease process, not put more responsibility on her husband. 2. The occupational therapist could assist the client in identifying ways to save energy when performing activities of daily living. Myasthenia gravis is a neurological condition that causes skeletal muscle weakness. 3. The HH nurse should realize that exhaustion is a symptom of her disease process and should utilize any member of the home healthcare team who could help the client. Allowing the client to verbalize her feelings about exhaustion is an appropriate therapeutic intervention, but this client needs specific advice on how to handle her exhaustion. 4. If the client is taking her medication, she does not need to be referred to her HCP. Myasthenia gravis is a chronic illness, and muscle weakness is the primary symptom. Content: medical/surgical, category of health alteration, neurological, integrated processes, nursing process, implementation, client needs, physiological integrity, physiological adaptation, cognitive level, analysis. Making nursing decisions. The test taker must be knowledgeable of the role of all members of the multidisciplinary healthcare team as well as HIPAA rules and regulations. These will be tested on the NCLEX-RN registered exam. 43.1. An epidural hematoma results from bleeding between the dura and the inner surface of the skull, and is a medical emergency. This client should be seen first. 2. Postictal state is a sleepy state the client has after having a seizure. This client is stable, therefore, this client does not have to be assessed first. 3. The client with encephalitis may have fever, headache, nausea, and vomiting. The client needs to be assessed but not prior to a head injury with active arterial bleeding. 4. The client with multiple sclerosis is expected to have scanning speech, therefore, the nurse should not assess this client first. Content: medical/surgical, category of health alteration, neurological, integrated processes, nursing process, assessment, client needs, safe and effective care environment, management of care, cognitive level, analysis. Making nursing decisions. The test taker should use some tool as a reference to guide in the decision-making process. In this situation, Maslow's hierarchy of needs should be applied. 44.1. The tension headache does not involve nausea or vomiting but may involve photophobia or phonophobia. Since the nausea and vomiting are not expected, the nurse should return this phone call first. 2. The migraine headache is a recurring headache characterized by unilateral or bilateral throbbing pain, therefore, this client should not be contacted first. 3. The pain of cluster headaches is sharp and stabbing, which is not like the pulsing pain of a migraine headache. This client does not need to be contacted first. 4. This is the typical type of pain clients with hypertension experience, therefore, this client does not need to be contacted first. Content: medical/surgical, category of health alteration, neurological, integrated processes, nursing process, assessment, client needs, safe and effective care environment, management of care, cognitive level, analysis making nursing decisions. The test taker must determine which sign/symptom is not expected for the disease process. If the sign/symptom is not expected, then the nurse should assess the client first. This type of question is determining if the nurse is knowledgeable of signs/symptoms of a variety of disease processes. Answers 198. Prioritization, delegation, and management of care for the NCLEX-RN registered exam 45. 1. The wife should check to determine whether the client is incontinent of urine, but the client's safety is priority. 2. The most important action the wife can take if her husband has a seizure is to make sure he does not get injured during the seizure. Moving all the furniture out of the way will help ensure the client's safety. 3. Seizures are not life-threatening. If the wife calls 911, the ambulance will probably arrive after the client's seizure has ended. Seizures lasting longer than 4 to 5 minutes warrant calling 911. 4. The client should be allowed to rest after the seizure when he is in the postictal state, but it is not the most important action to take. Safety of the client during the seizure is priority. Content: medical/surgical, category of health alteration, neurological, integrated processes, nursing process, evaluation. Teaching/learning, client needs, physiological integrity, physiological adaptation, cognitive level, analysis making nursing decisions. The nurse must be knowledgeable of the expected medical treatment for the client's condition. Safety is priority for the client, especially when the client is at home. 46.1. The client may benefit from a hospital bed, but this is not the priority intervention to address the client's non-healing pressure ulcer. 2. HH care agencies do not provide care 7 days a week. Even if the client could have an HH aid 7 days a week, it is not the priority intervention to address the client's non-healing pressure ulcer. 3. The client does not need to be transferred to a skilled nursing unit. The wound care nurse should attempt to heal the pressure ulcer in the home first. 4. The wound care nurse's primary role is to address non-healing pressure ulcers. This referral is the priority intervention. Content: medical/surgical, category of health alteration, integumentary, integrated processes, nursing process, planning, client needs, physiological integrity, reduction of risk potential, cognitive level, synthesis making nursing decisions. The test taker must be knowledgeable of the ROLE of all members of the multidisciplinary healthcare team as well as HIPAA rules and regulations. These will be tested on the NCLEX-RN registered exam. 47.1. Grab bars address safety issues, but the client is having transfer difficulty, which requires the help of the physical therapist. 2. In most situations, the nurse should assess the client prior to taking action, but the HH aide has the ability and knowledge to determine if the client is having problems getting out of the bed and into the shower. The nurse should allow the physical therapist to assess the client's transferability. 3. The goal of HH nursing is to keep the client as independent as possible, and having the client receive a bed bath is increasing the client's dependency on the HH aide. 4. The physical therapist is the member of the healthcare team who is responsible for helping the client with mobility issues. Content: management of care, category of health alteration, neurological, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, application making nursing decisions. The test taker must be knowledgeable of the role of all members of the multidisciplinary healthcare team as well as HIPAA rules and regulations. These will be tested on the NCLEX-RN registered exam. 48.1. Daily exercise, relaxation periods, and socializing are encouraged because each can help decrease the occurrence of headaches. This statement indicates the client understands the teaching. Two alternative ways of handling the pain of a headache include techniques such as relaxation, meditation, yoga, and self-hypnosis. This statement indicates the client understands the teaching. 3. Massage and moist hot packs to the neck and head can help a client with tension-type headaches. This statement indicates the client needs more teaching. 4. Foods containing amines, cheese, chocolate, nitrites, hot dogs, vinegar, onions, caffeine, and alcohol, especially red wine, can trigger a headache. The statement indicates the client understands the teaching. Content: medical/surgical, category of health alteration, neurological, integrated processes, nursing process, evaluation. Teaching/learning, client needs, physiological integrity, physiological adaptation, cognitive level, analysis making nursing decisions. This question asks the nurse to identify which statement indicates the client understands the teaching, indicating that 3 of the options are appropriate for the teaching, but 1 is incorrect. This is an accept question, even though it does not say all the options are correct except. Chapter 7 Neurological Management 199-49. 1. The nurse should ask if the client wishes to be a tissue donor, but the priority intervention is to address the family's grieving. 2. The nurse should give the client's personal belongings to the family, but the priority intervention is to address the family's grieving. 3. The nurse's priority intervention should be to address the grieving process of the family. 4. The client's body will have to be sent to a funeral home, but it is not the nurse's priority intervention. Content: end of life, category of health alteration, neurological, integrated processes, nursing process, implementation, client needs, psychosocial integrity, cognitive level, analysis making nursing decisions. The nurse must address all areas of the client's death, but the priority intervention is to address the client's family. Helping the client's family initially after the death with the grieving process should be the nurse's priority. 51. The family should designate a funeral home of their choice. The nurse does not make this referral. 2. Hospice is for clients who are dying, but this client is considered brain dead. 3. A home health nurse cannot help this client or family. 4. A 22-year-old client who experienced a traumatic brain death may be a good candidate for organ donation. Most tissue and organ banks prefer to be the ones to approach the family. This is the best referral. Content: end of life, category of health alteration, neurological, integrated processes, nursing process, planning, client needs, physiological integrity, physiological adaptation, cognitive level, application making nursing decisions. The NCLEX-RN registered blueprint includes nursing care that is ruled by legal requirements as well as the Joint Commission, Centers for Medicare and Medicaid Services, Centers for Disease Control and Prevention, and Occupational Safety and Health Administration rules and regulations. The nurse must be knowledgeable of these standards. 51.1. The client with cataracts is expected to have decreased vision and abnormal color perception, and will need surgery, but it is elective surgery. Therefore, this client does not warrant intervention. 2. Loss of peripheral vision is an expected symptom of a retinal detachment and should be seen because the client needs surgery. Without surgery, the condition could lead to blindness. But this does not warrant intervention over the client having pain. 3. A hordeolum is a sty, which is an infection of the sebaceous glands in the lid margin. It is not an emergency and is treated with warm, moist compresses to the eye 4 times a day. 4. The client with primary open-angle glaucoma reports no symptom of pain or pressure, so a client reporting eye pain warrants intervention by the nurse. Content: medical/surgical, category of health alteration, neurological, integrated processes, nursing process, assessment, client needs, physiological integrity, reduction of risk potential, cognitive level, analysis. Making nursing decisions, the test taker must determine which sign/SYMPT OM is not expected for the disease process. If the sign/symptom is not expected, then the nurse should assess the client first. This type of question is determining if the nurse is knowledgeable of signs/symptoms of a variety of disease processes. 52.1. Someone should call 911 because the client needs to go to the emergency department, but the nurse should first take care of the client. 2. The nurse should first stabilize the foreign object to help prevent further damage. The stick should not be removed because it will cause more damage and possibly enucleate the eye. 3. The nurse should not apply direct pressure to the eye. The nurse should stabilize the foreign object and not apply pressure, which could cause further damage. 4. The eye should be irrigated for a chemical exposure, not an impaled object. Content: medical/surgical, category of health alteration, neurological, integrated processes, nursing process, implementation, client needs, physiological integrity, reduction of risk potential, cognitive level, analysis. Making nursing decisions, the nurse should remember that if a client is in distress and the nurse can do something to relieve the distress, that action should be done first, before assessment. The nurse should select an intervention that directly helps the client's condition or prevents further damage. 53.1. The nurse and the UAP should protect themselves from injury. A lifting device should be used before attempting to move the client. 2. The nurse